Hey guys, welcome. We are doing Unlearn Your Pain book club. This is the first week. It's November 17th. And I was just telling the group as people were joining, I have the third edition of Unlearn Your Pain. And I realized because the PDF of chapters 1 and 2 of the fourth edition are free online. And I realized how different it is. A lot of the wording, the way he's phrasing things. For example, he would say like the nervous system learns something, and in the fourth edition, he'd say things like the brain learns it. So in fact, I had a little example. I just thought it was interesting. I wanted to share with you guys. So I guess I'm going to order the fourth edition, and hopefully that's what you guys had, and check out those first two chapters, of course, online for free. But he would say like, in the third edition, just as your nervous system has learned to make your body hurt, you can use your brain to unlearn the pain. In the fourth edition, he says, just as your brain has learned to make your body hurt, you can use your brain to unlearn the pain. So a few little differences, but the main parts of it, I think, are the same in the research and the workbook part. It's just a lot of the, as you can tell, if you've studied this kind of stuff, there's a lot of difference when you talk about, like, some people call it TMS, or Dr. Schubiner calls it MBS, mind body syndrome, or neural circuit disorder. There's a few different things that it's called. So I think as he's just refining his language, that's the main change we're seeing in the fourth edition. So I have a little presentation. I'm trying this a little differently with book club because I felt like some of the quotes would be easier to read, if you can read them on the screen with me. And since it was that PDF, I was able to just take some quotes right from the book that I felt were important that we can go through. So yeah, welcome everyone. This is so great. There's people from the Netherlands and France and Germany and Scotland and Ireland and bunch of places in the US and Canada. So welcome all of you joining and listening back. I'm going to share the screen here. And then pull this up real quick. Okay, admit. Okay. Hopefully I can still admit people while I'm doing this. So, oh, okay, share. Okay, present. Here we go. Like I said, I'm trying this out with these slides. So thanks for bearing with me. Here we go. Present. Okay. I think I'm not able to see the chat, but I'll look at it after. All right. So here we are, Unlearn Your Pain book club. And the first part, he talks about the truth about pain. So of course, there are cases that are requiring some medical attention. And there are ways later in the book to find out, really specifically if you're having this neural circuit pain. But really what's estimated is like 80 to 90% of chronic pain, and even more in some conditions, like I think Dr. Schubiner says with fibromyalgia, up to like 99% of it is this neural circuit pain. So with most people, chances are, if you have a chronic condition and you've tried all of the medical things and tumors and fractures and infection has been ruled out, with most people, it falls under this category of learned pain that can be unlearned. So the way he describes it is that you're hurting because of overly sensitized neural circuits of the brain. So the neural circuits, thinking of like neural pathways, even in volume 3, he was saying nerve pathways, but neural circuits, it's more just this brain producing this very real pain. He says when our brains create the pain that we feel, our brains create the pain that we feel. That's this big concept that, I was a physical therapist for over 20 years, and I thought that pain was because of tissue injury. And that's how the medical system tends to see it, right? But our brains generate pain. That's the big concept that we know now. It's not even debatable. Just all of the time, our brain is what's controlling how much pain we feel, whether there's tissue injury or not. And we know now that stress can cause the brain to fire those neural circuits. So this last little bullet point here, most importantly, since our brains generate the pain, all pain is the same, all pain comes from the brain, and all pain is real. So it's not like you're making it up if you have neural circuit pain. That's not at all what anyone is saying. And some of the times when we have pain and we're like, but it feels so real, it's hard to believe that it's neural circuits. But if you just think of, the brain is managing everything and in control of all of the sensations we feel. So it's real pain. It's just not indicating something structural that we need to have medicine for or surgeries for. Okay. So just as your brain has learned to make your body hurt, you can use your brain to unlearn the pain. That's the title. That's the main thing here. These are learned patterns. And with this knowledge and with these strategies, we can use our brain to unlearn the pain. So just a little bit about how chronic pain becomes chronic. Circuits from the brain are stimulated or fired. So you're just thinking of these neural pathways and circuits firing. And then these circuits can become wired into the brain circuitry like a habit. The brain learns this chronic pain, even though there's no serious medical condition in the body, or even though an injury may have and even though any injury that may have precipitated the pain has long ago healed. So basically, sometimes it can happen just out of the blue from chronic stress, prolonged stress, or you might have had an injury that was an actual, tissue damage type of situation, but after 12 weeks, even a bone heals. So 3 to 6 months is a conservative way of saying, like, after this amount of time, injuries heal. We know that injuries heal. And people, even with herniated discs, can be pain-free. There are many pain-free people that have these anomalies that maybe at one time did hurt, but have long since healed. So this thought of like, anytime we have pain, it being something structural, we're just really starting to see that that's not true. And one example he gives is phantom limb pain. So if you think of someone who has, part of their body has been amputated, they could still feel in their hand or their foot, even though that physical tissue is not there anymore. It's no longer there, but they're feeling very real sensations in the place where their foot would have been because of these neural circuits. And basically, we'll talk about how the brain learns it. 3 major components of the nervous system that create the vicious cycle of pain. So if you just think of what we're dealing with, there's nerves sending pain signals from the body to the brain, from the body up, the brain itself, where the nerve signals are interpreted, and then the nerves that send signals back to the body. So the best way to end chronic pain and other chronic symptoms is by retraining the brain, the controller of the nervous system, right? So instead of with most medical procedures and even with physical therapy, where I was teaching people a lot about having perfect balance and symmetry and posture and strength, we know that people who have all of those weaknesses and poor posture, there are people that don't have chronic pain from that. So it's not a cut and dry thing that everyone who has poor posture has chronic pain. We're seeing it differently now. So retraining the brain is what we're going to be talking about in this book every single week, how to do that and how to convince our brains that that's what's going on, even though in reality, it seems so real that something physical is going on, right? So modern medicine's treatment for chronic pain usually consists of pain medications, injections, or surgery, because it's assuming that there's tissue damage. Or like for me as a physical therapist, like I said, it was all about alignment and symmetry and perfect posture and having this perfect balance of strength and flexibility. So, but I saw so many people, and they estimate 1 in 4 or 5 people have chronic conditions. And so even though maybe they'd have surgery on their knee, then their other knee would start hurting, or their shoulder. So it would just kind of move from one place to another because it wasn't really tissue damage causing the pain in the first place. So cutting edge brain research demonstrates that it's possible to change these circuits and interrupt this vicious cycle. Part of the cycle is caused by our emotions. So he says, just about everyone who has chronic pain will react to that pain with fear, anger, anxiety, frustration, and other worrisome thoughts and emotions. These thoughts and emotions trigger increased pain by an amplification process in the brain. So basically, when we have a pain signal and then we're reacting with any fear-based emotion, that could be anger, frustration, irritation, anxiety, hopelessness, desperation, worry, we start to Google things, that actually amplifies the pain production in the brain. It's like a volume knob, turning it up. And that can be really annoying to hear, right? Because we have pain and we have certain reactions to it, and we get frustrated by it sometimes, especially if we know this stuff and it's still, we still get it and we can be really frustrated. But really, so much of unlearning the pain is how we're reacting to pain and realizing that our emotions are the biggest factor in amplifying or decreasing chronic pain. So I just want to, I feel like stopping the share for a sec, checking in. Has anyone put anything in the chat? How are you guys feeling about that information so far? I don't want it to just be me reading slides, but at the same time, it's nice, I think, to have those direct quotes right from the book, and then we can kind of unpack and dissect them. So looks like there's no questions or comments so far, but okay. You're with me? You guys with me still? All right. Yes, I got some thumbs up. Okay. Okay, good info so far. All of the above reasons. We got some virtual thumbs up. Okay, makes perfect sense. Isn't it great how he describes it? Like, I love the simplicity. Oh, and can I share the slides? Yeah, for sure. I'd love to share the slides. I can share the slides. It's super easy with this. I'll just send it out in the email with the replay. Oh, and Teresa, makes sense after all these years. Yeah, that's how I felt with like some of my physical therapy clients. Like I said, I'm like, maybe they have a chart that's really thick and they've been coming over and over for their back pain. Or like I said, it's like one shoulder and then one knee. And then, we'd be like, oh, okay, we just need to find this structural reason. And we're just always kind of chasing this thing to fix it. In the meantime, that's perpetuating that vicious cycle of pain. Yeah. And Laura, I always thought my posture causes my muscle tension, but it must be the brain. I know, it's so crazy. And I remember, sometimes even experiencing this myself. I had some kind of chronic rib pain for several years. And it was just usually pretty low, but I would stretch and it would feel good. And then, within minutes after stretching sometimes, or definitely within an hour, it was kind of back to that chronically tight state. And so I was like, well, how do I keep stretching, but then it keeps going back? And this explains it, because the brain is controlling the muscle tension, the brain and the nervous system. And when the nervous system's in a fear-based state, clenching muscles is part of it. And it can even be just one specific muscle group in your neck, right? It's like the right side of the neck. It doesn't mean all the time that because you're in fight or flight, everything tenses up equally. You could have this neural circuit pattern that's learned, for TMJ or for headaches, or for me, it was digestive stuff, IBS. But for me, it was learning that it wasn't the food causing the pain, it was the stress. Okay, so yes, starting to see that, and we just know posture, there are people with horrible posture that don't have chronic pain, trunk weakness and hip weakness, all these things, and don't have chronic pain. And then iPad says, my PT told me my brain was really sensitive, but he didn't give me any tools. I appreciate your perspective as a PT, your own struggles, and sharing with us. Yeah, thank you. Yeah, that's the thing. I wasn't trained in any tools, so I would imagine. I mean, I know PTs are learning about central sensitization now. I've talked to some people in PT school, and they're learning about Lorimer-Moseley and central sensitization, but still it is very focused on, but if we correct the structure, then you'll feel better. And that's just not shown to be true in research much of the time. Many times I've just Googled, like, can Morton's neuroma occur without pain? And that's like a inflamed nerve area in your foot. And turns out they've done some, like, I think they were like, what's it called? Autopsy studies or something, people that didn't have foot pain, and 10% of them had a Morton's neuroma. Or there was a study of young, healthy athletes. So these are people in their prime, they're young, they're athletes, functioning great. 89% of them had a hip labral tear. So when we start to do MRIs on healthy, active people, we see that some of these changes are just normal with wear and tear, and they don't cause chronic pain. In fact, they're not even inhibiting these young athletes' function. They had no idea. They had no hip pain or change of function. They just happened to do this research study imaging healthy young people and found all of these anomalies. So Dr. Schubiner has a great cartoon video series, and one of them is all MRIs are abnormal. And so it's really just emphasizing this shift away from it's structural to, like, maybe at one point you did have that injury and it's long since healed. Yeah. Yeah. And it does seem like, Roseanne says, it seems like there is a time to address structural issues. And it does, right? Especially when you have pain with movement. Like, I just had the weirdest pain in the top joint of my middle finger. And I was like, oh my gosh, I bet this is, what people would say is arthritis, or maybe I have gout or something, or it felt like, and it was with movement. So I was like, how could my brain be predicting that? And you know what I mean? It would be so subconscious. It seems like it's really something structural, but at the same time, I always question all this stuff, and it would come and go. And finally I had that one day and some jaw pain. And I usually don't get jaw pain, but a few days ago I'd had it on the right side, and then it moved to the left and the finger. And I was like, I'm just going to do some, like, journaling. And I did some rage on the page, expressive writing, and there were some emotions I didn't realize were there. And my pain in my finger was gone. So it's crazy stuff, but just being open, just opening the door to, like, okay, my brain creates all of these sensations. It can create numbness. It can create ringing in the ears. It can create headaches and dizziness and fatigue, all these things. Yeah. And then Laura, I was diagnosed with degenerative disc disease about 15 years ago. My back went through days of spasm pain. Now that pain is gone. I'm stuck with terrible facial pain, but the back pain is almost gone. I have bad scoliosis too. I know this concept is true. Yeah. Yeah. And I have the weirdest story. Maybe I can tell it really, really quickly, but I had a tiny bit of nerve pain. I'm not trying to compare myself to people who struggle with terrible facial pain, but I had, how do I tell this really quickly? Basically, I had an implant in my tooth, or a tooth implant that had gone wrong. And so I had to have it redone. And it was annoying and expensive. I didn't like it, And then I happened to see this picture of another area on the other side, the lower part of my mouth, where I'd been having an implant redone. And I think it just triggered in my subconscious, like, oh, there's an implant there. I hope that one doesn't go bad. Because literally that day, I started getting pain in that tooth, the lower right-hand tooth. And then later that day, it went into my jaw, and then got facial numbness and, this just weird sensation in my face, half of my face. But it was nothing else had happened other than I saw that picture of where that implant had been done. And I think really my brain, there was so much resistance to that happening again. For some reason, I actually started creating that identical pain to the tooth that did go bad. Does that make sense? So I was so skeptical of it because of what was going on. And I was under stress during that time. So I just chalked it up to that. And the next day, that numbness was gone. And that's when the other side of my jaw started hurting. So when this kind of stuff starts happening, right, this is, and I've been doing this work for a while, and not to be discouraging, but the more that you can just be like, oh, okay, this happens, this comes and goes. Usually my symptoms don't stay more than a few hours or a day. So knock on wood, right? But that kind of thing can happen. And the more I do this work and talk to people and see all those things that can happen, when I start getting them, then I'm like, oh, okay, the brain's producing this. It produces all this stuff under stress. So yeah, hopefully with that facial pain, you'll be able to use all those same concepts that you did with your back and decrease the fear and increase the safe state, so that you can decrease that brain producing the facial pain as well. Yoshin, recently I've tried to explain to a 30-year-old client who had an accident and 9 knee surgeries. I think and hope that should have to hurt. Oh, that should not have to hurt anymore. But she totally didn't buy it. Yeah, definitely. It sounds probably pretty crazy to a lot of people that there isn't something structural going on after all those surgeries or after, all these accidents or things. But there's, sorry, I just read a message. So there's a study even about whiplash, and he talks about it later in the book, but places where they don't have whiplash and treat you for whiplash, people don't have whiplash. So it's crazy how when we have expectations of like, well, after 40, I'm just going to have pain, or because I had all these knee surgeries, it makes sense that I have pain, or, I never got over that accident. And it just makes sense to people. This way is new and it's revolutionary. And, it's starting to expose that some of the ways that we've been treating pain, very expensive and painful ways, like surgeries, back surgeries, especially, like they're not solving the problem of chronic pain, because it's not because of the degenerated discs or because of the herniations or because of even things like nerve impingement have been unlearned. The pain has been unlearned, even when that structural thing is there. So what I like to say for myself and for people that I help is, maybe there is something structural, right? Like they're going to argue, I have all of this titanium in my foot, and, of course I have pain from that sometimes or whatever. But you could say, yes, there could be something structural. You were diagnosed with degenerative disc disease. I'm not arguing that structural thing isn't there. It's just, we know that these structural things don't cause chronic pain. Yeah. But yeah, when people don't buy into it, I think, it doesn't hurt to just kind of sprinkle those seeds and plant those seeds. And as a physical therapist, now I just practice with coaching. And so people are pretty bought in by the time that they are talking to me. But when I was trying to broach the subject as a physical therapist to people, usually what most people would agree with is that stress would make their symptoms worse. And then you could always, sometimes people have one of those experiences where they were on vacation and felt less pain. Not everyone has that, but sometimes there's those little things like that people can start to see, oh yeah, stress and emotions are related to my pain. Like that does make sense at a basic level. And then we get into this weird stuff that even I'm still surprised by, right? That I'm like, my body could produce that. My brain can produce that just because of stress. Yes. And Laura, people will accept when they're truly ready. I never would have believed this years ago. Exactly. If I didn't have the digestive things, like if I had just had chronic pain, as a physical therapist, I probably wouldn't have looked into the mind-body approach, and I wouldn't think it was anything other than structural, and that I just needed to be more perfect with my posture and my strength, it's like very perfectionistic way of looking at it. But this way is more comprehensive. You're looking at the whole person. You're looking at the stressors of life. And there's overwhelming results that stress can cause these symptoms in our bodies. So nice. I think I'm going to go back to the slides. We'll share the screen. Oh, actually, there's one more comment I'll read. If I had not been desperate, I would not have tried the techniques, which worked. I think that says, there's this little bubble over it. I also tried somatic tracking and the symptoms went to 0. Yeah, like that is such good evidence. If it doesn't happen that way, it's not necessarily evidence it's not going to work. But when you do have those kind of things that you're sitting there, pain goes from a higher number to a 0, nothing else has changed, you haven't moved, all you've done is think about things differently, that's some good evidence there for you. So yes, I'm glad some of you who are here, it sounds like already have some knowledge of this stuff and have been applying it. So I think we'll be able to have some time to talk about some of the things that you guys might have questions on. But I'm going to go back to the slides and we can go back to just finishing kind of the concepts that we're talking about here. Okay, so thoughts and emotions, whether we're aware of them or whether they're subconscious, are major factors in producing chronic pain and related syndromes. Thoughts and emotions, okay? In addition, the stress that frequently accompanies these symptoms, such as decreased activity, decreased income, more difficult relationships, adds to the problem by making the stress-producing neural circuits stronger. So we may start with a back injury, and then because it has been accompanied with a lot of fear and stress, and maybe there's decreased activity and you can't do the exercise that you love and it's affecting your job. And so there's stress that way and it's affecting your relationships and your home life, right? So it's easy to see that pain can cause stress. And then what we're linking up here is that stress actually, it's like that vicious cycle, stress can cause pain. And it's easy to see where, if someone has had some chronic conditions, it's not just the stress from the pain that they're dealing with. There's all of those secondary implications that add to their general level of stress. So he calls it this vicious cycle, and that's really what it is. And then certain traumatic experiences in childhood leave an imprint on the brain, making it more likely to develop the vicious pain cycle. So definitely we know there's that study about the ACEs scores, so the adverse childhood experience, and that's like decades long research that they've shown that traumatic experiences basically correlate highly with chronic conditions, even autoimmune and things like that. But here where we're just talking about mainly neuroplastic pain and the chronic pain that he's talking about here, it doesn't even have to be a capital T trauma. So they can be lower T traumas, you call it, right? So a trauma of everyday life might be like even falling off your bicycle or hearing bad news or witnessing violence or being alone. So like they could be capital T or lower T traumas. Dr. Schubiner, I think it's later in the book, even says it could be something like being teased by a bully when you were in 3rd grade. And then your nervous system becomes a little more guarded and on high alert. And then in your 30s, you're developing something like, chronic pain or IBS or something, right? So for me personally, I did not fit into the category of having a high ACEs score or having capital T traumas. So I'm like very fortunate to have loving parents and family support. But I was also raised in a religious environment that for me was perpetually stressful because I thought that I was really bad all of the time. And I think I was just on a little more high alert and high guard because I, learned all the fawning and people pleasing, and I wanted to be a good girl and, all of these things. So my nervous system was kind of chronically stressed over time, even though I had great, loving, supportive parents and things like that. So don't rule yourself out of this working for you because you have very little trauma or because you have a lot of trauma. Okay. So it's very closely related to the nervous system and to how the body functions under stress. And that's why these chronic conditions can be highly related. And then people who have a great deal of unresolved stress are also more likely to have chronic pain. Okay. Our brain works to protect us from tissue damage by creating pain. And it also works to, quote unquote, protect us from stress and any emotional, quote, injuries by creating pain or other symptoms as a warning or alarm. So our brain can create pain if we sprain our ankle and we have tissue damage, and it will create pain so we don't keep walking on it and damaging it further. But it can use the same neural pathways, neural circuits to create pain to protect us from stress or to protect us from emotional injuries, right? So the brain kind of doesn't distinguish, is it a physical injury or threat, or is it an emotional threat? Either way, the brain can produce pain and get into that habit of when that trigger comes up, producing that neural circuit pain. So when there's an alarm, you could even use the example of like a fire alarm. If there's a smoke detector and a fire alarm, we want to know, is there an actual fire, or is someone just like cooking toast and that activated the smoke alarm? Because a lot of times we're busy trying to find the fire and put out the fire when really all it is this misinterpreted signal. And so we deal with that very differently, right? Many symptoms, in addition to pain, that can be caused by these wayward connections, such as diarrhea, insomnia, ringing in the ears, fatigue, bladder symptoms, anxiety, or depression. Okay, so it's not just chronic body pain or neck pain or back pain. There's a whole list later in the book of common conditions that are mind-body. So mind-body syndrome, or MBS, that's one of the names you'll hear it called. It's pain that occurs in the absence of a physical injury, such as neuroplastic or nociceptive pain syndromes and central sensitization. Part of what's hard, right, is like doctors might not have even heard of it, or maybe they're calling it central sensitization and looking at it a little differently. Nociceptive pain. There's all of these different terms, and not everyone knows, uses the same terminology. Oh, I think I got a chat. So yes, there's some things in the chat I'm going to go to. I read Sarno 10 years ago and didn't buy in because I wasn't ready. And his book isn't as intuitive as Dr. Schubiner's or Alan Gordon's are. This practice has certainly evolved. Oh yeah, totally. Mary, even when I started coaching, it's before The Way Out came out and Curable was just new. And so I was using a lot of Sarno stuff, and I kept, going to this repressed anger thing, or, the feeling the emotions. And it's nice that Dr. Schubiner's way and Alan Gordon's way, it's more brain focused. Of course, the emotions can be part of it, and that's part to address, but it's not all that's there. We don't have to always be like, okay, what's this repressed anger about your mom? And you're like, I don't have any, I don't know. It's like, that can be frustrating, which could cause more pain in itself, right? But Sarno has worked for tons of people, probably hundreds of thousands at this point. And then Caitlin, my symptom is that I feel pressure in my bladder 24/7 after giving birth and getting nasty UTIs. My ACE score is, oh darn, what is it? Is 9. So it makes sense why I got TMS. Yeah. Yes, exactly. I mean, I've noticed once I heard that like bladder symptoms could be part of it, I've been able to resolve incontinence. And I have a podcast episode of that. I have like some kind of mind and body things I combined, but just knowing, oh, all of these different things I've had many clients with like heart palpitations, and they go and check out, everything is fine with their heart, but stress and anxiety can cause those rapid heartbeats and heart palpitations. So just really being open to, if you're the type of person with a high ACE score, or you're kind of more of a sensitive person, or you have a history of, even as a child, I would get like a lot of stomach aches, and I had my tonsils removed because I got a lot of sore throats, and I did gymnastics, so I had back pain, probably more than a normal kid, because I thought that was normal for gymnastics, but, probably it's just my MBS or neural circuit issues showing that higher, dysregulation of the nervous system, high guard, high alert, that I was kind of under this chronic stress. And so now when I get new stuff, it's very easy to question that, because I just see it that way now. So much more. Okay. Oh, that's probably the end of our slides. That's why. Okay. So I love, like I said, I love having those slides, because it's helpful there's a lot of words, and it can be, even one of those sentences could be a lot to unpack, but hopefully that makes sense. I think it's making sense to those of you who've been commenting. And then Roseanne, sometimes rage on the page can increase the symptoms. What do you suggest then? Yeah, definitely. Okay, sorry, I'm like actually thinking as I'm talking, so I'm going to change what I was going to say, because it can happen differently for different people. And even one time rage on the page, or some expressive writing might increase your pain one day and decrease it another, even within the same person. So it's important, just like with somatic tracking, to not tie whether it's working or not to, if our symptoms increase, that can just be that chance to distract or practice more neutrality. So specifically for increasing symptoms, when you're doing, like, I call it rage on the page, just like that expressive writing, you can be really mad and say those yucky things that your brain sometimes thinks, get it all out on paper. But for some people, if that increases their pain, it may be that reaction to, they haven't been comfortable expressing anger, for some reason as a child. Either they saw anger as dangerous, or it's not a good thing to have, so subconsciously repressing it. So I'm sounding like Sarno here, but like, at the subconscious level, you start to feel angry, and you just push it down without even knowing that you're doing it, right? You're like, no, it's okay, he's trying his best, and it's really just my fault. You know what I mean? Like that kind of not being used to anger. So one thing could be just like, when you have higher symptoms, anytime you have higher symptoms, it's always fine to do those avoidance behaviors, distract, be really easy on yourself. Like, those are not the times to try to do your best, somatic tracking and work, right? Because usually if you're very dysregulated and you have a lot of pain, that's when it might be good to just grab the heating pad and lay down and watch a show that gets your mind off it until you are, just like either a little less painful or less dysregulated, to where you can actually process what's going on. So that would be my advice if rage on the page or expressive writing is triggering more pain. And then what I would probably do is just like introduce yourself to anger a little bit. So you could do this somatically with someone, or even like somatic tracking anger, but it might be easier to do with someone, where you're starting to feel those sensations of anger, and you just describe it like it's a heat feeling in my face and a tightness in my chest and in my jaw. And as you somatic track anger, it can become less scary and more normal. So I don't know if that resonates with you, Roseanne, about anger particularly being triggering, but that's what I'm guessing. And anytime the symptoms go up, just don't blame yourself. It's not because you're failing or there's no hope for you. It's a sign that your nervous system and your brain are at this stage of evolution, right? It's kind of like we've stirred some things up, And so it can actually mean that you're on the right track, not that you've done it wrong. Okay, Roseanne says true. Okay. And Teresa, what is the ACE score? So ACE stands for Adverse Childhood Experiences. And I think they started doing it, before the 2000s, in the 90s or something, studying people. So they have, you'll look online and you can do a little test, answer questions to see what your ACE score is. And they say, if it's over a certain amount, you're more likely to have chronic conditions and to have health effects in your body. So, okay, Allie, how do you make sense of Alan Gordon's approach versus Dr. Schubiner? I know there are a lot of similarities, but Dr. Schubiner seems to emphasize journaling and focus on emotions, while Alan Gordon seems to emphasize getting rid of fear and focusing on safety. Would love to hear your thoughts. Yes, that's such a good question. I think this came up in the Tell Me About Your Pain Facebook group too. And Lisa Brannigan, she works with Dr. Schubiner. And so she answered and she said, basically, Alan Gordon's approach, PRT, pain reprocessing therapy, is more of the brain-based approach. And it has great results, but it might not be all that you need, especially if you have more of the emotional stuff going on. So PRT is a good first line of approach, first line, right? And then if you're needing more, that's when Dr. Schubiner's stuff can be really helpful. But as far as the brain-based approach and focusing on safety, all of that is going to be the same in both approaches. But I just think of Alan Gordon's as kind of the first layer of the onion or whatever. It's the, a lot of people can heal just by understanding that there's not something physically wrong and retraining their brain and having less fear. But, if there's an underlying pattern of repressing anger because, you were taught that anger means you're bad, then your body is always going to keep having some responses as you're not just allowing that emotion. And so Dr. Schubiner's work, you guys, you're gonna love it. It's gonna go so deep. So get ready. And then Tara, following with a gratitude practice or meditation can be helpful. Yes. Okay, that's a good point. Yes. If you are doing that rage on the page or that expressive writing, you can always have a moment for a meditation or some gratitude. I know that's what Nicole Sachs recommends. She worked with Sarno. So I really encourage people to start to do whatever is more downstream for them. So if you think of upstream and downstream, it's like you're putting your canoe in the river. You could either paddle upstream and see how far you get, or you could just let it flow and go downstream, and you're going to get further. It won't be as exhausting. And so what I mean by that is journaling for some people may be really upstream, or doing EFT tapping, or when you're in a lot of pain, doing those things can feel upstream. Maybe on another day they feel downstream, they feel good to do. But learning for you, and this is the most annoying part, right? Because no one can just tell you, do these 5 things and then it will always work. Because even from one person, one day to the next, a strategy can quote unquote work, right? Or not. But really it's just, learning to be really gentle and compassionate with ourselves and not think that, okay, I have to, do it this certain way, like this person has told me, in order to get the results. It's kind of that perfectionistic attitude. So yeah. Okay, what do you think about knee inflammation? Could that be TMS? I think it is not listed at the book. So yeah, so it's not necessarily listed, but we do know that the brain can cause inflammation. We do know that. There's a study he talks about later that they took people with CRPS who had, it was affecting their hands, and they had them imagine doing a hand motion, and they produced inflammation in the joints just by imagining doing a hand motion. So that proves that just like we learn those cycles of pain we can learn things like inflammation, or that that stress or the nervous system does control the inflammation. So yes, definitely that would be something that you can question, and then you can look for days that it's different, detective for the opposite. But yeah, that could be TMS. Oh, and then someone linked the ACEs score, or the ACEs test. So that's in the chat. Anna says, I have a hard time somatic tracking because whenever I sit down to do it, my pain goes up. I think Alan Gordon says not to do somatic tracking if your pain is above a 4. I don't know if it's above a 4 that he says. Anyway, it's probably not super important to like say, you know, what exactly that level. I was thinking it was more if it's like an 8, 9, or 10 not to do somatic tracking. I don't know where he says not to do it if it's above a 4, but maybe he does. So, but somatic tracking, when the pain does go up from somatic tracking, usually that is a sign that it's stressing you out in some way, right? You're focusing on it and the brain is producing it more. So sometimes you might be able to be neutral about it still, you know, like, oh, okay, interesting, you know, my pain went up. Or if you're on your own doing it, maybe you're like, oh no, my pain went up. You know, what's wrong? I should never do this again. So somatic tracking doesn't have to be that the pain always goes down, but definitely if you've done it and the pain goes up, that can be a scary thing. One thing that you can do, he suggests, is focusing on positive sensations. So if you go to do, you know, you have a lot of knee pain, you go to describe that knee pain, it starts getting worse as you're describing the shape and the color, then focus on a part of your body that feels good. If the breath feels good, that can be one that you can focus on and turn to. Maybe it's just something neutral, like your earlobe. You just focus on some other part of your body, and that can be a way. But if your pain is really bad and none of those are working, that's when avoidance behaviors or distraction, that's your best bet. We're sometimes resistant to like laying down on the couch and watching a show or something, but sometimes that's just what we need to get our brain distracted enough to decrease that pain, so that then we can start to understand what's going on. But yeah, do it laying down. Yeah, if sitting is painful, do it laying down. Yeah, I would definitely say somatic tracking, if you're trying it alone, it can be a little harder. If you get a chance to try it with someone, that can even go differently. But sometimes when we're doing it with such urgency, or we're really wanting it to change, then it's just so annoying, but it does the opposite. It gets worse, right? So, and then it could probably get scary to try it again. So definitely be gentle with yourself, and you can, you know, do kind of just bit by bit with that somatic tracking, maybe not going right to the painful area, but just noticing and describing other parts of your body, like ones that feel good. Okay, how do people get over shame of having their sensitivity as the cause of their symptoms? I feel so bad about it. It's been for so many years. Yeah, definitely that sensitivity, it's easy to see it as something bad, right? It's like, why am I so sensitive? Why am I so different than everyone else? There are about, like I said, 1 in 4 or 1 in 5 people that fall into this category. And this may sound annoying, so I'm not going to try to be Pollyanna and spin it into something that you're like, yay, I love it, I'm so glad. But also, the way I've started to view the sensitivity is that I have some extra sensory information than other people. So it can actually start to be a gift or a superpower that I have this sensitivity. Now, it doesn't always feel like it, because I'm like, you know, why do I go into freeze over just sending an email? But when I have some body response over some stressful thing, I'm more aware of it than another person, right, who's oblivious. So as I change these things in my life and make these lifestyle changes and start worrying less and stop being so critical of myself. Like my body is pointing me in this direction of how I will be my best self, how I'll show up in the world the best to help other people without all of the fear. And my body is helping me get there with that extra information that I have that not everyone has. So I know depending on where you are, you might be like believing that, and that might feel good, or you could be so far from that that just sounds annoying. And you're like, yeah, well, that's for you, but not for me or whatever. So be compassionate with yourself where you are. But definitely that shame, that's part of the freeze response. So things like self-compassion, Kristen Neff has just oodles of research and books and meditations about self-compassion. But that's been a big part for me. Is I think a lot of my symptoms were because I was so hard on myself and so critical of myself. And so learning to see my uniqueness as strengths. And, I don't fit into the mold in a lot of ways, but I'm maybe a little more creative and a little more intuitive. And right, there's some other things that come from it that I've started to see as strengths, not just weaknesses. And then Tara says, yeah, Schubiner or Tara, Schubiner also focuses on safety. It's true. His meditations attached to this book include somatic tracking. Right. Yes. So he definitely, like I said, it's like he focuses on safety, just like Alan Gordon. And then his is the kind of like deeper dive into the emotion part of it too, but it doesn't contradict what Alan Gordon's saying either. Right. And the book on anxiety and depression, I've heard, I actually have it. I should read it. I bought it. But I've heard that the first few chapters of the anxiety and depression book are different, but the strategy is all the same. So the workbook and the process and the emotional expression, all of that is the same. Yeah. Oh, Alan Gordon has an Instagram post on how to deal with high levels of pain not using somatic tracking. Yeah, okay. That would be a good one to reference. Yeah, because definitely when there are high levels of pain and we try to do the work of like somatic tracking and journaling, and then the pain gets worse, it can be, that vicious cycle versus using the heating pad, taking a bath, calling a friend, you know what I mean? Those kind of things. And some strategies work better depending on the cause, like childhood factors versus current life stressors versus conditioned responses versus personality characteristics, like perfectionism and putting pressure on oneself. Exactly. So for me, and I really noticed something that stresses me out, what other people think. Someone else next to me might be like, you're thinking of that? Like, they have no idea that you know what I mean? They're not thinking of that at all. They don't care what the other person thinks. They laugh at that. So yes, it's a very individualized journey, but both of them I think can be so useful. Oh, these are such good questions. We have a few more questions I'm trying to look through because we're getting close to the end of our time here. But yeah, what is the point of somatic tracking? It's just being neutral when you have sensation. And there's a lot described about that in The Way Out. And there are meditations about it. I have a meditation for somatic tracking on my podcast. You could try. Oh, okay. This might be a good question for like a little deeper approach or a little deeper answer. But my symptoms started right after giving birth to my first daughter. I really want one more kid, but I wonder if my body's telling me no more kids. Maybe my body's keeping the bladder sensations there to keep me from having another baby. How do I approach my thoughts on this? Yeah, definitely. Like there could be I would just look for what kind of emotions are coming up with the sensations. And if it's fear related, then anything that's fear related is going to amplify your pain. So whether it's a story that you're telling yourself that's stressful about, my body not wanting it, or just looking at, I think definitely like I like journaling to try to get some clarity on my thoughts, or just getting coaching on it is so, so helpful, to know what thoughts are there. Because it sounds like most of us, you have some conflicting thoughts. On one hand, I really want to have a baby. And on the other hand, there's maybe a lot of fear there because of the sensations and pain that started right after having a baby. But having a baby is one of those major life stressors and life changes. So it's very easy to understand how pain after having a baby that doesn't go away after 3 to 6 months is neuroplastic. Oh, and then someone's asking about scar tissue, and after surgery, definitely, I used to say, oh, if people still had pain, oh, it's probably the scar tissue, because that's when people come with pain, you want to give them an answer. But yeah, Dr. Schubiner says scar tissue does not cause pain. There's many, many people that have scar tissue that don't have chronic pain. I guess I'll do one more. My mom has lived a very difficult life, lots of trauma, stress, etc. She has very little pain. I just can't figure out why I'm so opposite. Why can't I deal with stress? I think this is a way of dealing with stress, and this approach is going to help you see that it's not necessarily better to not have the body symptoms. So sometimes it shows up in other places, or with it's hard to explain, but definitely thinking of it as we're having these symptoms because we can't deal with stress. That's probably a thought that doesn't feel very good and is not very helpful. So some of the stuff that you're dealing with, they even know there's intergenerational trauma. And so some of her stressful life, you could be programmed, your nervous system may be a little more stressed out just because of what she's gone through. So have a lot of compassion for yourself. And again, you're not alone. And there are other people feeling bad and working through this, but the more we can start to see it as like, okay, we are different, but it also can have some benefits, right? This nervous system is always being rewired, and we have this capability of addressing all these issues that people might go to therapy for and get coaching for. We're just doing it as we're changing our lifestyle to unlearn this pain, and it will have a great result, right? Like less stress, less worry, and then the brain will produce less pain. Okay. We have such great questions. Okay. Think, I don't know how to save. I might be able to save these. Maybe we should have a little like group where we can ask some questions too. Sometimes I've done like a little pop-up Facebook group. So, because you guys have some great questions here, we're not going to get to everything. We will be doing chapter 2 next week at the same time. Chapter 2, you can still find that free PDF for it. And I'll see if I can't, I think I might be able to save some of these chat questions and answer them later for you guys too. All right, thanks for joining. Have a great rest of your day, and I will send the replay and see you next week. Bye-bye.
Thank you. Bye.
Thanks.
Thank you so much. Bye.
Thank you.
Bye. Thank you.
Bye. Bye.
Bye, guys. Thanks.
Thank you. Have a good day.
Thank you.